from our Stakeholder Advisory Council about the impact of COVID-19 on families during on dementia care. And I'd like to introduce Sarah Massoud, who's going to chair the panel. She's the Community Outreach Coordinator for the Caring for the Caregiver program, and also the project coordinator for this PCORI funded project. So Sarah is going to go ahead and introduce the panel. Thank you so much, Sarah.
Thank you so much, Dr. White. I'm so thrilled to be the one who gets to introduce this amazing panel. So I am just thrilled to be inviting our incredible advisory council who have been working together for a PCORI funded project. And the project that we're representing today, the goal of that project is to better understand the impact of COVID-19 on dementia care and the experiences of individuals living with dementia, family caregivers, and professionals in various fields of dementia care and support services. So for the sake of time, I'm going to try to keep introductions brief. I could talk for hours about all these amazing people. So starting with Janet and Bill Zinsmeyer. Janet and Bill are unwaveringly committed to the fight against Alzheimer's. A few years ago, Janet was diagnosed with Alzheimer's disease, and now she and Bill work together as proactive partners in her care. Over the years, they've dedicated countless hours as volunteers for the Alzheimer's Association, serving as chairs for the Walk Against Alzheimer's and fundraising money for Alzheimer's research. And Jenny Funk, who a lot of you probably recognize, is the Director of Programs at the Alzheimer's Association San Antonio and South Texas chapter. And anyone who's had the privilege to meet Jenny can attest to her unmatched commitment to developing high-quality education and support programs for families living with dementia. In her role at the Alzheimer's Association, Jenny has seen the impact of COVID-19 on families living with dementia and will share her experience with us today. Myra Mendoza is a caregiver and advocate in San Antonio, Texas. She's the primary caregiver for her parents and her mother's living with dementia. She's committed to people and to bettering their day-to-day lives. And this is apparent in her dedication to advocate in political spheres for representation of caregivers in legislation and her role as a member of the advisory council for this project. Myra is passionate about representation of Latina voices at all phases of research, and today we'll hear her perspective as a Latina caregiver supporting her parents during COVID-19. And last but certainly not least, we're going to hear from Dr. Neela Patel, Chief of the Division of Geriatrics and Palliative Care in the Department of Family and Community Medicine at the Long School of Medicine at UT Health San Antonio. And not only is Dr. Patel a well-loved physician to families living with dementia, she's also a dedicated researcher committed to several projects that aim to improve the lives of families living with dementia and focuses on supporting underserved communities. Today, we'll hear from Dr. Patel about what she has seen in terms of the impact of COVID-19 on families living with dementia, and what has been the experiences of families living with dementia in receiving the vaccine, and why it's important to maintain safe practices to mitigate the spread of COVID-19. So I'm going to start with Janet and Bill. Are you ready to go? Wonderful. I'm going to stop sharing my screen so we can see your lovely faces. There we go. So starting with you, in our research, we've heard from caregivers and individuals living with dementia about some of the challenges they've experienced during the pandemic. So if you could, in 5 or 6 minutes, please share what are some of the more challenging things you've experienced since COVID-19, and what are some of the strategies you've implemented in your life to cope with those challenges? If you'd unmute, please. Can you unmute, Bill? There you go.
Okay. Well, Janet is having a tough day today, but she's here with us. So the issue of the COVID-19 and the pandemic is that we were shut down from our relationship with our program that had been developed to give Janet help. And we had to be creativity of trying to figure out what we could do since we were cut off from our community. We were cut off from our family, and it was just she and I. That's good. I mean, we've been married for 55 years, so that's okay. But
that old? Don't Don't tell them that.
So we worked on trying to get out on our own. Took rides in the car. We pack a lunch, stop at a roadside park, try to get away. It helped, but the truth is it was not enough. Janet got a lot worse from the disease. She had about half of her short-term memory. In about 90 days, she lost it completely due to the fact that we don't have anybody for her to touch or visit with or talk with. She spent 55 years with me married, and she is a very active person with people, her children, her grandchildren, her friends. When you cut her off, it was like another stab in the back with this disease. So I tried everything. We tried music. We were formerly professional dancers. We tried dancing. We did everything. It helped a little, but they're just not an answer when you don't have the people. You gotta have the people. Mm-hmm. And I'm sorry, where we are today, it's not the screen. It's not looking at the screen. We looked at pictures a lot of times, tried to go back and think about things that we did in the past. That's not the answer. You gotta have touchy-feely relationships with people. Yep. And we did the best we could.
Thank you so much for sharing today, Janet and Bill. Janet, I know today is a difficult day, so we are extra grateful that you made time for us and we could see your beautiful face.
Thank you. I would always make time for y'all.
Oh, we appreciate you a lot. And thank you for speaking to your resiliency and all the different things that you've tried to cope with during the pandemic, and your ideas we've shared over the months with other families, and it's definitely made a difference. So thank you for being so vocal and willing.
Oh, you're welcome. It's my pleasure.
Thank you. And we will have time. I want to encourage the audience to enter your questions for each of our panelists in the Q&A. We will have time for questions after each panelist has spoken. So let's move on to Ginny Funk. I wanted to ask you, Ginny, what are you seeing as the Director of Programs at the Alzheimer's Association? And what has your organization done to keep going since COVID-19? And I actually have two sort of related follow-up questions. What have you seen as the director, the challenges families are facing, but also as an organization, what have been the challenges for you as the Director of Programs in supporting families during the pandemic? And how have you partnered with other chapters to address the challenges?
Absolutely. Well, it's so good to see all of you, especially the Zinsmeyers. I very much wish I could reach out and give you a hug. You're right. The screen is not near enough. And I just also have to say, my goodness, Katie, to follow Katie, what an incredibly inspirational, amazing individual. For her to share as much as she did, and all of that being so personal, I think that has such an impact on the future of all of this. And really, an event like today, being able to share such personal things, it makes all the difference. And I have to say, again, the Zinsmeyer family, as much as they share, if we compare that to the hundreds of people that we work with, hundreds and thousands, who do not share, it makes all the difference. So it has been a year. We're at an anniversary from when, as a national nonprofit organization, the Alzheimer's Association basically told us to go home, get out of the office and start working from home. We immediately started learning Zoom, and at first it was Blue Jeans. And so we had to figure out how to continue to be able to reach caregivers and people living with dementia while not being able to do anything in the office anymore. So we started with our early stage support groups. We have one on Monday and Thursday. An hour is for the person living with dementia. It's their support group for them to be able to meet and discuss, and then the other hour is for their caregivers. So we turned that into a Zoom format twice a week. We brought in one of our amazing volunteers who's a social worker. He offers a caregiver support group twice a month for us. We turned all of our classes that we do, all of our educational, all the different topics of classes that we do, we turned all of those into a Zoom format. Reached out to all of our volunteers across our chapter to find out if they would be willing to teach a class on Zoom. And I'll be honest, we definitely lost people along the way who said, we'll wait till we're back in person. We really would prefer that. It's been hard. I can't even imagine from a family's perspective. We have definitely seen that the isolation that already exists from all of these dementias, when you add on COVID and cut out the in-person, just makes it even more isolating. So we also have, I would say, absolutely worked more with other chapters of the association than we have ever done before. So now in the state of Texas, we meet regularly. I'm a program director and I meet with the other program directors of the other chapters, and we borrow, what's working, what's not working. Are you reaching people if you offer a class in the evening, or is it better in the morning or over someone's lunch hour? We have a monthly calendar of classes where we honestly have about 2 classes a day, since we're able to combine resources like that. So I feel like we've been able to reach people more who maybe before wouldn't be able to get in their car and come to one of our programs, but now virtually, if they have the ability to, they can sign in. So, but we know there's still a lot more people that we're not reaching, either because of technology, but we always try to encourage people, even with Zoom, you can still call in on your phone. So if you have a telephone, you can still dial in.
Thank you so much, Ginny. I really appreciate that overview, and for everything that you and the Alzheimer's Association are doing to partner with each other. We do have a couple of questions about, you mentioned some of the pros about virtual technology and being able, and I've heard it in our work at UT, in some ways people are more connected, and in other ways there are some people who are not able to connect. So we'll maybe loop back to that at the end in the Q&A.
Sure.
All right, thank you so much. So I'm going to turn to Myra. Myra, as the daughter of a person living with dementia and the primary caregiver to both of your parents, what are some of the biggest challenges you've experienced since COVID-19, and how have you coped with them? And I also just want to invite you, just knowing you and having observed your work over the years as an advocate for Latina caregivers, can you speak to the experience of Latino families living with dementia during COVID-19, and potentially any thoughts on how they can be better supported?
Sure. Good morning, everyone, all 178 of you caregivers and care advocates that are joining us. I'm so happy to be here. I'm so happy to share. I'm so happy to learn with all of y'all. I always show up to a speaking engagement or an attendee, yes, as a caregiver, but forever as a student, because that is what I would be doing if I wasn't caregiving. My name's Myra. I care for both of my parents. My father is in his late 80s and my mother is in her late 70s. My mother is living with vascular dementia. For about going on 7 to 8 years. I've lost track over the years, but I regularly hear that is a really long time. And I'm so grateful to be able to say that very publicly and loudly, patting myself in the back here, that is in huge thanks to my privilege in being able to have direct care to impact her day-to-day activities. I cannot speak for all Latino caregivers. I can only speak for myself and my family and my immediate members who Sarah very often regularly advocate for, because from day one of caregiving, I've always, every time that I would learn caregiving information or healthcare information, or anything related that helped my mother, I would always relay it back to her. One, I would relay it back in non-healthcare terms. Two, I would relay it back in her first language, which is Spanish. And three, I would have to break that down culturally. And many times that was even harder.
It's 11:30.
Apologies for that, but it is 11:30. That's my computer speaking. I would have to break that down so that she could receive it in her culturally competent knowledge. And that has made my caregiving process an experience where she learns along with me, because she's living, right? I'm simply her care advocate, but she is the one living with this disease. And so she's telling me what her care needs are as I'm educating her about what is going on in her mind and in her body. And so my flag in any time that I learn is forever, where are the other Marias? My mother's name is Maria. Where are the other Marias, specifically here in San Antonio, where there are so many? You know, we are a Hispanic Latino majority city, metropolitan city of millions of residents who remain undiagnosed and or who are diagnosed, who remain unmedicated and who remain unsupported. And then do they or do they not have a Myra in their life with the capacity to advocate and ask questions? And I'm here because I attended a essentials class some 2-3 years ago, right? Through the Caring for the Caregiver program at UT Health. And quite frankly, I simply asked too many research questions. I was intrigued, but more importantly, I was there after close to 2 to 3 years of caregiving part-time, while still at the time working full-time, and not understanding or knowing enough, but knowing enough that I knew my mother, both of my parents, but my mother specifically, deserved a dignified care. And I was not getting that. I was not getting answers. I was not getting support. And I knocked on many doors, and the response, I think, was very helpful, and it was very well intentioned, but rarely, if ever, still is it culturally competent. For example, we advocate for the benefits of Mediterranean diet for dementia and Alzheimer's patients because it is healthy. So trying to change overnight a diet of someone who individuals who are set in their ways later in life and trying to apply that, I've had to make all sorts of Mexican/Mediterranean diet combos in order to incorporate what works for them. I share that because I think it's really important to advocate for families specific to their needs. And so that's what I try to do with my mom, specifically to COVID. Obviously, the diet was impacted because of access to groceries and being able to stay home, not having additional respite care. And then not being able to have family over for respite care, but specifically, a lot of things going online. The digital divide, specifically in Latino communities, is vast, and it's very, very obvious. And so I share this because I think it's important that all of us as caregivers continue to speak for everybody else that may not be on the screen, that may not be at the table, and that involves a lot of Marias like my mom. I have many more thoughts and other ways that we were impacted, but I think for my family and my immediate community, we were newly impacted. I think COVID has only magnified, unfortunately, the ways in which health disparities have already been vast. And I'm so bittersweet happy that that is the case, because it's highlighted now. I'm not happy for the pain and the suffering that happens because of it, but it's highlighted. And so we have opportunities like this where we get to say, well, now we know. And with knowing comes a responsibility of all of us to say, how else are we including our neighbors? To assist them and support them too, because they're going through the same caregiving journey that many of us are.
Wow. Thank you so much, Myra. That's so eloquently said. And you said we need many more Marias, but we also need many more Myras. So thank you so much. We have a question that came through to you. So we'll get to that after we hear from Dr. Patel. So Dr. Patel, last but not least, as a trusted healthcare provider and researcher, can you speak to the importance of getting the vaccine and continuing to wear our masks to protect ourselves and others, especially those living with dementia, given recent evidence that reflects their higher risk for more severe forms of COVID-19? And can you share with us your experience as a care provider during COVID-19 to families living with dementia and how you've adapted to deliver care during the pandemic?
Thank you, Sarah. Myra, that was very powerful. Janet and Bill, thank you for sharing your story. And Jenny, thinking out of the box.
Dr. Patel, unfortunately, you're getting cut off. Do you mind potentially maybe disabling your camera so we can just hear your audio? Try again.
I'm sorry, I don't know what happened. Okay. So I'm going to start with the second half of the question first to say that, a lot of challenges with the COVID introduction of telehealth and one lack of telehealth resources among some communities, and even those who had it were not very familiar on how to use it. So one of the things we did, and we realized that the touch was missing. The physical presence, seeing the person physically. And so we started doing a lot more home visits and seeing patients in their homes if they allowed us. Again, initially, we did have some challenges with some communities not wanting us to go to their homes. We've even had them be on their porch, and we've been outside with our masks and gowns and face shields and tried to have a conversation with them just to make sure they're better. We also worked with the House of Neighborly Service with their promotores, because the patients allowed the promotores going to the house, but not us. And, they would FaceTime us, and that's how we connected with them. But now the home visits is something that patients and caregivers really like, and we like it too. So we have increased our visits. 50% of our visits now are home visits, and 50% are in the office. So, and everywhere, all over town. We go right up from Seguin to Hondo and Floresville to New Braunfels. Okay, so anybody who needs it, we give it. And we really made a list of our persons living with dementia and caregivers and prioritized doing home visits for those persons first. Coming to the importance of the vaccination, I just cannot tell you how important it is for each and everyone to be vaccinated, including the caregivers, because the personal touch can happen only after most of us are vaccinated, and despite being vaccinated, the CDC does recommend that everybody still continue to wear their mask and maintain all the precautions of distancing and hand washing and all that. Although the CDC does say that if you are meeting with lesser people and all have been vaccinated, they do say it is okay to be without your mask over there, but we would still maintain the distance and everything. But the importance of getting everybody vaccinated is so, I don't know how much to emphasize and highlight on it, because the virus is nature, very strong, and keeps on mutating. Okay, so it boosts our immune system when we are getting vaccinated. So even if the mutant occurs, we are getting we are going to be a lot more resistant to that virus. And if we do get infected, we'll have signs and symptoms and not have asymptomatic infection. So that way there won't be a lot more people having the infection out in the community, going and spreading it around. It'll be easier to pick up the cases who have got it. Okay. I would recommend everybody who can take the vaccine to take it, including caregivers. So UT, first round, we gave the vaccines to all the faculty and staff. Then we gave all the vaccines to the 1A and 1B. And now we've opened it out to the public. And through the School of Nursing, everybody is being scheduled to get the vaccine. Even if they are not a UT patient, we are getting them the vaccine. And in our practice, we've also got the Johnson & Johnson vaccine, a few doses. So those who are allergic or scared of taking 2 doses, they can get vaccinated with 1 dose. But get vaccinated so we can get back to a normal environment and to a normal life, to put people back on track. Bill and Myra, I've seen, like, just like the pandemic of COVID-19, just because of COVID and the change in a normal environment for persons living with dementia, some people who were not diagnosed with dementia, we've diagnosed now because there has been a sudden change to their environment and a sudden change to their life. And it's become very challenging for a person who has underlying dementia to adapt to that change, to express how they are feeling. The reason things declined is the person experiences and knows everything. The challenge is in communicating what they know and understand. And then, when you don't talk, you're not able to express yourself, you're losing the vocabulary, and you're losing, your abilities that you've had before. So please go ahead and get vaccinated. Let everybody who knows, who advocate. Just like we've been advocates for fighting against Alzheimer's, we advocate for everybody to get the COVID vaccine if you want to live a normal life.
Thank you so much, Dr. Patel. I really appreciate it. And I see some people responding to your sentiments in the chat. I want to invite Dr. Carol White. I know we have some questions that came through at registration that I think we were going to direct to some of our panel members. But if you don't mind, I'd like to read the question that came through the chat box, if that's okay. If we could start it. It's directed at Myra, and I see that you're typing an answer. Would you mind reading the question out? I can read the question out loud, and if you would mind verbally responding. So Beth asks Myra, how do you suggest professionals engage people who might be exhibiting symptoms of memory loss to get a diagnosis? And how can we engage Latinx or Latino, Latina caregivers in educational opportunities? So Myra, I don't know if you'd like to answer, and any other panelists, if you would like to chime in.
I was typing this up, but thank you so much for your question, Beth. I would recommend identifying a trusted individual in the life of the person experiencing the memory loss. Sometimes that is the health professional, but many times it is not. And I think the important thing is that it's a case-by-case basis. Minority communities in general, but the Latino community specifically has a complex history and present with healthcare, right? It's not just a history of a bridge that does not exist of trust, but also access. And so I think identifying someone that this person already trusts and them serving as a bridge to educate them and to bring them in and create a support system around it is very, very important. As far as engaging Latinx caregivers, I don't know how helpful this is, but it's the best that I could do, and it is to be absolutely intentional in your outreach. I cannot express enough how many times I have been sought out because of my skin tone or because of my ability in being a fluent Spanish speaker, or because of my eloquence. I recognize those and I value them. But there are individuals who are not bilingual, you know, that are second generation Latinos who are English speakers only, who don't have a higher education, who are white passing, if y'all are familiar with the term. They don't look the normal Latino that we expect to see. And none of that takes away from their experience as a Latino identifying person. It also doesn't take away from the expertise that they have. They don't have to be bilingual. They don't have to be college educated. They don't even have to have a high school diploma to be able to share, to be able to grasp the knowledge that they are taking in from caregiving. They have taught me so much, but I think the important thing is to be very intentional in seeking them, and two, to do so consistently. I'm here because both Dr. Carol White and Sarah have consistently been intentional, and it's not sporadic. It's consistent from beginning and end, and it's just really being respectful of all of the different experiences and expertise that we come with, despite a title, despite a skill set, expected skill set, etc. So yeah, intention and consistency. I think be genuine about your outreach and engage them consistently, not just a one time as needed.
That's incredibly helpful. You said, I don't know how helpful this is, but consistency, intentionality, being genuine, that is, you know, easier to say than do, but it makes the difference. Thank you so much, Myra. That's really important contribution. Dr. White, we had some comments come through at registration. I wanted to see if there's any that you'd like to direct at our other panelists.
There is one I'd like to ask Dr. Patel, and anyone else can feel free to join in. And it's about, now that we're getting more people vaccinated, is there any risk that caregivers should be concerned about if they have a paid caregiver who comes in the home and they've been vaccinated? I think you've probably said some of it already, but if you could just reiterate in terms of being cautious.
So even if they are vaccinated, we are recommending that the caregivers, because you're not related and from the same household, that you still do wear the mask and you keep the distance when you're not, you know, taking care of personal care needs right away. And also hand wash and a gown, you know. Sometimes for persons with dementia, it becomes difficult with the communication when you're wearing the mask and the face shield. So even like when we've gone to see patients, we've been more than 6 feet away and tried to look at the person and talk to them, so that you're talking directly to them and not to the caregiver, you know. And we tend to place the caregiver behind the person, so that even if you're looking in that direction, you're talking to both the person and the caregiver. But we are still recommending that all caregivers, so for our home health and hospice agencies where we have our extended team members go and visit our patients, we are making sure that everybody's wearing a mask, wherever appropriate, a face shield, gown, gloves, and then that they're changing and hand washing before and after, you know. So it is important. I mean, we cannot become complacent once everybody is vaccinated. We would have to use the precautions when you're meeting or you're getting care from people who are not from your household. Because you don't know where the other person has gone, if they've been exposed to another person. Are they taking care of only our parents or our family, or they're taking care of somebody else too, and where their family members have gone. So it's the same for all of us healthcare people also. That's why everywhere when we go, we are getting screened with all the same questions. And I don't think that changes, because even though everybody gets vaccinated, we're still going to have to be very vigilant about anybody with symptoms of fever or cough or, runny nose or sneezing or nausea or diarrhea, all the same COVID symptoms, you do want to say, oh no, now that we're vaccinated, no, the virus has not gone anywhere. We still have to test for COVID and make sure it is not COVID and follow the isolation precautions and all.
Thank you so much, Dr. Patel.
I think you hit mute, Dr. White.
I did, of course. Ginny, I had a question for you. You talked about a lot of the programs going online. And of course, I think a lot of us are concerned for people who aren't able to be connecting virtually. Is there things that we could do? I think Myra talked a little bit about what we can do as neighbors, but are there other things you might recommend to be supporting people that aren't able to do virtual connections?
Absolutely. And again, if people do have a telephone, at least in that way, we know that they can still contact our helpline, which is 24 hours a day. They can still join into classes and support groups. They don't have the benefit of being able to, like we do, at least see each other on camera and make that connection, but at least with voices, be able to join in that way. We know that Senior Planet and some of the things that they're doing, they're focusing so much, especially in San Antonio, but some of the surrounding areas on how they can help with the digital, having so many people who don't have access. So, so check out Senior Planet. I'm trying to think if there are other resources. I would say many of us sit on different committees and different groups, and we're just always trying to figure out how can we reach more people out there who have no idea that there is a lot of support available, and sometimes it's really just still sometimes that stigma of, if I don't reach out, I don't have to address this. But we know that doesn't mean that that it goes away. So it's just really trying to figure out how to just get that first connection with someone to then be able to know that from then on, they're not alone. No one has to be alone during all of this, no matter how long this goes on for.
Thank you, Ginny. Sarah, I think we have time for one quick question before we go to the break. And I'd like to ask, do we have time for one quick question?
Yeah, we do.
Yeah, I wanted to ask Bill and Janet in terms of how you were so able to speak about dementia and the diagnosis, because again, as we talked about, many people don't, and how important that's been for our community as well as I think beyond. And you just suddenly unmute, Bill. I think you're still muted. There.
I think it's early on when the devastation kind of started sliding downward to where we were knowing where the heck we were. And we met with the Alzheimer's Association that there were many, many people suffering with this disease of which we knew nothing about. And Janet felt like that the first thing we needed to do was get involved in trying to find a cure, meet with other people who are suffering with it, try to expose the disease to more people so that people were not in the same position we were in, which was basically blinded by where to go, what to do, what do you do next? I mean, we have a doctor tell us, yeah, I'm diagnosing you. You definitely have plaque in your brain and you have Alzheimer's. And after we swallowed a few times and tears are running down our cheeks, what do we do next? And they say, I don't know. I don't treat Alzheimer's. And I don't know anyone that does. So we felt it was a call to us to say, don't let that happen to anyone else. We race, creed, I don't care who it is. We want all to know. No one should be in that kind of position. No one. And it's our dedication till we go home to the Lord. We're going to continue to fight that other people will not go through. And I know they're going through it this very minute. I know they're out there right now, and I wish I could touch them and say, please come and talk with us, and let's figure out where we need to get you next so that you can be treated.
And also, when I was diagnosed, I did cry out to the Lord, and I said, why? Why did you allow this in my life? Everything was going just fine. And he said, because I want you to go out there and help other people. And I told Bill, oh, okay, I'm in. I could do that, by golly. So.
She's back.
Wow, you guys are so inspiring to all of us. Thank you so much, Bill and Janet.
We're glad to do anything we can.
Thank you.
Thank you. And I think you really touch on how important it is that we deal with the stigma.
Thank you, Sarah. Thank you, Carol.
Yes, thanks to all of you.
And just all of you, and especially our Dr. Patel. She has been a motivating factor, as Carol has been.
Yes.
The UT Health Science Center, the Bigs, saved our life. The Bigs saved our life. We were on our way to Baylor Medical School to start my wife having some kind of treatment. And God presented a man in the lives of all of us, Glenn Biggs, to form a Alzheimer's Center in San Antonio. God bless that man.
Yes.
And his family for what they have done for this community and the surrounding area. Because we were lost, and it's there for everyone. For everyone. It's for everyone. That they need to get in touch with the Bigs if you have any kind of issues. And I've sent numerous people there already who were lost and are getting care now and know what's going on in their lives. And also caregivers like myself who now participate in the Alzheimer's Association and participate in meetings with us, and we share with each other what to do and how to help each other.
It's a big help.
To treat your loved one who's suffering with this disease.
Thank you.
Thank you so much, Bill. And I think we don't want anyone to go through what Katie talked about, her husband going through 8 doctors to find a diagnosis. So if you live in an area where there's a specialized center, you do want to get there to get the diagnosis. Sarah, I think we have time for questions. We're going to take a short break.